afternoon. My name is Bonnie Tran with the Department of Healthcare Services. Thank you for joining us today. This is a webinar on keeping your community covered for schools and families. All attendees are muted and are on listen only. If you would like to ask a question, there is a Q&A option on the bottom right hand corner. If you would like to ask a question, please direct questions to all when you submit so we don't miss any of the questions. There will be a Q&A session at the end. This session is being recorded and will be made available online with closed captioning. Our first speaker is going to be Teresa Hasbrook, who will introduce herself and kick off the meeting.
Hi, good afternoon, everyone. Thank you so much for joining with us today. We know everyone is very, very busy. Hopefully we'll have a few more participants as we continue in our introduction. I am the chief over the policy development branch within Medi-Cal eligibility. Myself and my team have been leading many of the continuous coverage unwinding efforts and related to policy and engaging and outreach efforts. And so this particular session is really targeted around connecting with our partners out in the community that work with schools and families or are part of the school system to ensure that we provide some helpful information and resources for you to use in order to continue coverage for many of our Medi-Cal members. Let's go ahead and move into the next slide. And so I'm sure many of you are already familiar with the Medi-Cal program, but just in case, Medi-Cal is California's version of the federal Medicaid program, and we provide healthcare coverage to over 15 million Californians. This includes healthcare coverage to low-income adults, many children within California, pregnant individuals, elderly adults, and individuals with disabilities. And we know as part of the public health emergency and even sort of beyond that, how critical that healthcare coverage is to ensuring people stay healthy here in California. We offer a full set of benefits that includes things such as doctor visits, individuals' prescriptions, maternity and newborn care, mental health services, dental services, and a variety of other different types of services to ensure individuals can have access to healthcare coverage. In California, different than some of the other states, we actually have our local county offices manage most of the Medi-Cal cases in California. This ensures that you are being and our Medi-Cal members are being addressed based on where they're living in the community and really meeting the needs of the local county. So we're going to go into the next slide and just talk a little bit about annual renewals. So for as long as the Medi-Cal program has existed, we've had some sort of annual renewal that individuals needed to complete on a regular basis. As times have changed, the annual renewals have varied, but one thing that was a huge impact is when the public health emergency went into effect in 2020. There was a declaration to keep people in coverage. And as part of that continuous coverage requirement, California stopped requiring the annual renewal for our Medi-Cal members. Of course, none of us could have predicted how long the public health emergency would last, and what started out to be believed to be just a few months ended up to be almost 3 years in a continuous coverage requirement. So during this time, our Medi-Cal members continue to receive their Medi-Cal coverage at the same exact level year after year without having to complete any sort of annual renewal process. Now that the public health emergency has ended and the continuous coverage requirement is no longer in place, we actually need individuals to begin resuming submitting those annual renewals. And we want to make sure as this process begins that individuals don't lose coverage. In California, we began the resumption of Medi-Cal renewals on April 1st, 2023, and those were for individuals that had a renewal month in June. And so for us, June is really the beginning month of renewals that are considered to be the continuous coverage unwinding period. And for this first 12 months, from June 2023 through May of 2024 will be the first time many of our Medi-Cal members have received or completed an annual renewal for over 3 years. The renewal process to determine eligibility is resuming for all of our Medi-Cal members, and so this is something that's impacting us across the board. So into our next slide, we're going to talk about what's happening with Medi-Cal renewals right now. So we mentioned that we're going to need to do these renewals, but what do those activities actually look like? So counties have already started processing renewals. We started in June of 2023, and we know now that we're getting almost to that halfway point. And so counties have been sending these out to our Medi-Cal members. Medi-Cal members have begun to complete these annual renewals. And unfortunately, this also means that some of our Medi-Cal members have begun to lose coverage, either because they no longer meet the qualifications for Medi-Cal or because they did not comply with the renewal process. We're going to be continuing this process, like I mentioned earlier, for 12 months through the month of May of 2024. However, I think all of us know the Medi-Cal annual renewals are not unique to this year. What makes this year unique is that it's been several years since the renewals have been required. But even before the public health emergency, we were losing individuals for not submitting their annual renewal form. So even though the continuous coverage unwinding will officially be ending in May of 2024, the annual renewal process will be continuing years into the future. So as we walk through today's presentation, we hope that our partners within the school system and those that work with families will continue to leverage these strategies to assist our Medi-Cal members year after year with annual renewal processing. So how does this really impact our community? So speaking specifically for this continuous coverage unwinding time period, California estimates that we can lose 2 to 3 million people over the next 12 months as we begin to resume normal operations. Unfortunately, many of the individuals that are going to be losing coverage will be for procedural reasons. These will be things like not turning in the annual renewal or not providing an updated address with the county so that when the county is reaching out to get additional information, they don't have the proper contact information to be able to obtain it. We're making sure that Medi-Cal members know that they need to take steps now to renew their coverage and continue with coverage if they're still eligible. And even though individuals may have had their circumstances change during the public health emergency or even over the last year, there are lots of enhancements and changes that have been made to the way California transitions people from Medi-Cal into Covered California. So even if they're not eligible for Medi-Cal any longer, we want to ensure that they move into some type of healthcare coverage, either through an employer, through another entity, or certainly through Covered California. So a little bit closer to home, we know that many of our audience that's participating today is engaged in either being part of the schools or supporting the local schools. And so we really want to make sure that more specifically we talk about the impact this has to schools and school districts across the state of California. You know, first, a little bit later in the presentation, we're going to be walking through how California actually works with our school district on certain billing for school-based services. And so this is particularly impactful to those schools that are working closely with DHCS and do receive some Medi-Cal billing based on services that are provided to students. We know how critical those school-based services are and want to ensure that those continue, into the future. And so making sure that families that are currently on Medi-Cal continue with their Medi-Cal ensures that they're able to receive those school site services on an ongoing basis. Even beyond that, for schools that maybe are not partnering with DHCS in that same way, we know how important it is for students to be healthy. Healthy students mean that they're in the classroom more often, that is not impeding their learning and their education. and all of those valuable things and results that come from students being in the classroom. There are lots of studies that show that children without health insurance have school attendance that varies from those that do. And so keeping people in Medi-Cal coverage and making sure that they have access to healthcare, both preventatively as well as on an ongoing basis when a sickness does arise, means that they're going to have much higher success within the school system. So how do individuals actually complete their renewal when it comes time? And so just so everyone has a little bit of an understanding about what that process looks like, the very first thing that happens is the local county office will use the information they have on file to attempt to renew Medi-Cal members without having to reach out to the Medi-Cal member at all. During the continuous coverage unwinding, California has received lots of different extra flexibilities to make that process even simpler. For example, we have a waiver where if individuals' income is under 100% of the federal poverty limit, they actually don't have to complete the renewal if that is still the same income amount that they're reporting to the local county office. So for those types of situations, the local county office is going to renew the Medi-Cal members' Medi-Cal without sending out any sort of renewal packet. The Medi-Cal member will receive a letter in the mail and will let them know that nothing additional is necessary at that time. However, we know that not everyone is going to meet that criteria, especially because there's been so many changes over the last couple of years that may mean the county doesn't have the updated information needed to complete that automatic renewal. So in those circumstances, a renewal packet will be mailed out to the Medi-Cal member. Those packets come in a bright yellow envelope so that they're easily identifiable when a family receives this. For some of our families, this is going to be the very first time they receive a renewal and may be confused by the process and unsure what they're supposed to do. And so it's really important as we continue down this path that our partners, particularly those that work with so many of our Medi-Cal members who are children within the school district, help us in ensuring that folks have awareness that the Medi-Cal renewal process is taking place and what they can look for to ensure that the Medi-Cal renewal can be completed. So what Medi-Cal members need to know is, one, if they have moved or even if it was a year or two ago and they never reported that address information, or if they're reporting a new address to their local school, it's really important to ensure that they're also providing that updated contact information to the local county office. That information can be reported in person, by the telephone, or even through the online portal that individuals have access to called Benefits Cal. And we'll talk about that a little bit further as we walk through. It's also important for them to know that they need to check their mail. And we know that some folks don't know when their renewal is going to take place because it's been so long since they've had to go through the process, and that's okay. As long as we're making sure that we let Medi-Cal members know to please look for that bright yellow envelope or any correspondence from the local county office, that it's important to open those that mail timely and respond to whatever information is in there. And then lastly, just reminding them to create or check their online account. We know that there are so many ways nowadays to access information on the web, and a web portal for Medi-Cal and some of the other social services programs is available, and that's called benefitscal.com. Every county now across the state is on the same portal, which makes things a bit easier. By logging into that portal, they'll be able to see when their renewal is due. They'll be able to actually complete that renewal online if they choose to. They'll be able to upload their renewal if they prefer to complete it outside of the system, but submit it through the online portal. And they'll even be able to track the progress of the renewal as it goes through the processing with the county eligibility workers. So this is a great resource for our Medi-Cal members to be able to use as they're accessing Medi-Cal services. And so once individuals actually receive a renewal form, and that's the one where they actually need to do something and take action, it's really important for them to read the instructions on the renewal form. Of course, we know that the instructions on the renewal form are not always clear, and that sometimes these forms can be very confusing. And this is absolutely where we're relying on our partners in the community who work closely with our Medi-Cal members, who may need to be there to assist our Medi-Cal members as they go through the process. So similarly, these are also great tips for our partners to be able to use as they're assisting our Medi-Cal members with completion of the renewal form. So read the instructions on the renewal form, and then complete the renewal form and send it back. The way all the renewal forms are now done is that information the county has on file is pre-populated and put directly into the form. The individual will need to review the form to determine whether that information is still correct. If it's still correct and the form asks them to turn in proof of that information, they should attach a pay stub or whatever proof it's asking for with the letter. If that information is not correct, they will have the opportunity to write the correct information in the form and send that back with proof as well. And so hopefully, even though it is a lengthy packet, because it is pre-populated, the hope is that it's a little bit easier than maybe in the past to go through the information that's included on there. One important reminder, especially for our partners working with parents and their children, is that even if a parent doesn't want Medi-Cal anymore, they still need to complete the packet if their children want to continue to receive Medi-Cal and their children are listed on the renewal packet. A lot of times parents think that if they don't turn it in, they're the only ones that will be impacted. But unfortunately, if their children require a renewal as well, their kids could lose coverage if it's not turned in. And then finally, even once they turn the renewal packet in, there may be instances where the county needs additional information. So it's important to remind our Medi-Cal members that if a packet is sent out, that they still need to keep an eye out in the mail or log into their Benefits Cal website to see if any additional information is needed in order to complete their annual renewal. And there are, unfortunately, as much as we would love to ensure that folks stay on the Medi-Cal program, we know that unfortunately there is going to be time where we're going to have Medi-Cal members that lose coverage. And that actually might be at the point that within the school systems, you see that come up. So a couple of different things. If the reason they lost coverage was because they didn't turn in their annual renewal packet, the great news is in California, they have 90 days after they've been discontinued to turn that packet back in. So even if their benefits have been terminated, they can complete the annual renewal packet, submit it back to the county within that 90 days. If the individual is still eligible to receive Medi-Cal, the county will actually go back to the date that the Medi-Cal member lost coverage and put them back into coverage. If they're no longer eligible, even at that point, the local county office will help transition them into covered California eligibility at that time period. There may be times where somebody becomes discontinued and they don't agree with that decision. Maybe the income that was used to determine the Medi-Cal eligibility doesn't match what they think their income should be. And so at any point, they can reach out to the local county office and try to resolve any discrepancies they have with the case. If they're not satisfied with the response by the local county office, every Medi-Cal member has the right to file a hearing, and this will give them an opportunity to have their case re-reviewed by a third party to determine if the county actions were correct. So that covers our basic Medi-Cal renewal process. And so hopefully that provided some information just about how important the Medi-Cal renewal itself is and some helpful tips about how to actually complete the renewal form. Now I want to turn it over to my colleague, Regina Zern, who will talk a little bit more specific about some of the partnerships that DHCS and our local school programs have.
Thank you so much, Teresa. And it is definitely a pleasure to get to talk about this today because, as Teresa was mentioning, we most likely have lost a lot of the initial contact information. And what better place than schools who get their contact information for students and families updated yearly. So this is a great opportunity for us to work together. So I get to talk today about programs that we're allowed to do with our two school-based programs. And so we have the local educational agency Medi-Cal billing option program, which I'll be calling LEA BOP, and then also our school-based Medi-Cal administrative activities program, which I'll be referencing as SMA. And so for the local educational agencies that are participating in both of the programs, they can take part in this outreach and application assistance activity. And the reason they have to be, the LEAs have to be participating in both programs is because we will be using the LEA BOP data match output file, which I'll talk about in just a second, to do a couple of SMA administrative activities, specifically outreach and application assistance. So we can move to the next slide for the LEA BOP data match output file, which is a file that is used by the local educational agencies, and they submit what we call an input file that has identifying information about the students who have primary enrollment in that particular local educational agency. And then that input file is bumped against the Medi-Cal eligibility data system to determine whether or not those students or which of those students are enrolled in Medi-Cal. And so then DHCS returns an output file that has all of the Medi-Cal enrollment information. So that output file includes all of the components that were on the input file, the student's name, date of birth, and then also if they're enrolled in Medi-Cal, it has information about when they were enrolled, and if they have become disenrolled at any point in time. So that's the value of the data match output file, which is pivotal for this re-enrollment process. And so we can go to the next slide and talk about data use agreements. So because those output files have protected information, well, I'm getting ahead of myself, sorry. We have data use agreements for the data match process. And so an LEA can complete a two-party agreement or a tri-party agreement. And the tri-party agreement is used whenever the local educational agency has a billing vendor who's going to be doing the data match process for the LEA. And we can move on to the next slide. So the reason that the DUAs matter is because they have protected health information and personally identifying information. So we have to safeguard that PHI and PII, and the data use agreements identify who can use the data and how the data can be used. Doing anything outside of what is described in the data use agreement may be considered a breach. And it's a really serious thing. So even if you have all this data literally at your fingertips, you can only use it for the purpose of the DUA that you have entered into with the Department of Healthcare Services. And so that is why the criteria for participating in this re-enrollment activity requires that LEAs be involved in both LEA BOP to get the data match output file, and then also in SMA to do the administrative activities related to outreach and application assistance. So I'll move on to talk about the three different LEA BOP data use agreements. And so we have the regular one that has nothing to do with re-enrollment. It's just what's used to get the Medi-Cal eligibility information. And then we have a second one that is for redetermination. And so that DUA allows the LEA to use their LEA BOP output file for ESMA outreach and application assistance, but it only lets them know when somebody has lost their coverage. So it's good, it's better than nothing, but it's not great. But now we have a new data use agreement. We have a third one for the LEA BOP program. And that data use agreement will allow them to use their LEA BOP output file with a new piece of information, which is the renewal date. So we're pretty excited about that. We're able to give the data before they're disenrolled. So, but that third one is just going to be limited for this tiny process that we're doing. So it'll end at the end of August. So I'm going to go on and describe the 3 different LEA BOP DUAs in a little bit more detail. So that first one, the regular one, that's the one we use for the Medi-Cal eligibility ratio. That's done usually in October. And it also helps, gives permission to find out what the Medi-Cal enrolled students' benefits identification card information is for the purpose of submitting claims. And then it also gives permission in the event that a student or their family has requested information in an alternative format. It gives permission to use the data for that. So those are the 3 uses of our regular LEA BOP data use agreement. And then our second data use agreement is for redetermination. And so that uses our very current data match output file, like I was mentioning before. And in this case, it allows that data match output file to be shared between the LEA's LEA BOP personnel and their ESMA personnel. And then the ESMA personnel can do outreach and application assistance activities. And both of those are reimbursable activities. The way that you can use the current data match output file for redetermination is you would go to the column that's called record eligibility to see if they've been enrolled in Medi-Cal in the last 13 months. And then you would look at the column that is called eligibility indicator to see if they're currently enrolled. So the folks to be reaching out to are those who have a record eligibility of yes, they have been enrolled in the last 13 months, but their eligibility indicator is no, meaning that right now they are disenrolled. So those are the folks that we want to reach out to see if they qualify for re-enrollment. And then we have our third and newest data use agreement. It's going out today. I'm very excited. And this is a brand new data match output file. And where our current file has a column called the Benefits Identification Card or BIC issue date, the new data match output file will have a column called Renewal Date, and it will provide the information in a three letters for the month and 2 numbers for the year. So it could be like NOV23 for November 23, similarly DEC 23, JAN 23 for January 2023. And this will give renewal information up to 60 days in advance. So it's an excellent opportunity to reach out before they have lost enrollment. The first data run that we do on this will include all of the disenrollments to date. And then after that, later files will only have about 60 days worth of data. And this will go through August of 2024. As Teresa said, the disenrollment for this first year ends in May, but there will be that 90-day period that she was talking about. So we'll be having the data through August of 2024. And this will be an entirely new Move It file location. So it'll be different than the current process. And this, similar to our second DUA, it can be shared with the ESMA personnel for outreach and application assistance. This does not replace our regular data match output file for LEA BOP. And in fact, this DUA does not give any permission for using the information for claiming. This is just something specifically for the purpose of redetermination. And then I was hoping to get the e-blast out this morning, but it's going out this afternoon. So you can look for an e-blast from the LEA BOP listserv, and it will have the data match or data use agreement attached to it. And then if you have any questions, you can always email us at lea@dhcs.ca.gov. So I want to pass it over now to Bonnie Tran, who's going to let you know about some resources that are available to communicate with the schools and their families.
Hello, my name is Bonnie, and I am going to go over the resources hub that we have created. And so, as part of the communications outreach campaign, we have created a Keep Your Community Covered resources hub. This is a one-stop shop to share all of the latest communication resources that we have. All of these materials that we created were based on feedback that we received from our ambassadors, navigators, and community partners. We are updating these resources regularly, and they are available in 19 languages. And so these are just some of the social media graphics that we have available. You can, once you go on the resources hub, you can share it directly onto your platform by clicking on the bottom link. So if you have Facebook, you can just click on that and it will share from there. Or you can download the graphic if you want to share it on your own platforms as well. And we just wanted to note that the sharing function on the resources hub is only operational for English and Spanish due to the translations. Some of the languages read opposite directions, so we're not able to share it that way, but you can download it and share it that way if you would like to. We also have print materials that are available. We have customizable flyers, posters, and palm cards. These are all available in all of the 19 languages. Some of the materials that we have are customizable, so you can either add your own logo or add your contact information, website, or whatever you need to. There's also, so some of the flyers have a text box where you can add this information. We also have the how-to videos that are available on YouTube and also for download on the Resources Hub. The videos are all available in 19 languages. These are the same videos that we've used in our advertising campaign. You can download these videos and share it on your platforms, or you can share it directly from our YouTube. And we also have the captioning files available if those are needed for your upload. We also have tailored audience resources. So we created many different resources for our partners. And this includes in-home supportive services, managed care plans, providers, schools and families, and older Californians. So these resources are targeted to these groups specifically. And these are the resources that we have available for schools and families. These are just some of the social media posts that we created, so you can copy and download these and share it on your websites or on social media platforms, schools' social media platforms, and whatever they have available. You can share this, and you can share directly from the Resources Hub as well. And so this is what it looks like when you're on the Resources Hub right now. So for English, these are all of the available content. So once you click on it, it will automatically download, and then you can share it that way. And so some of these there's key messaging, additional messaging, social media posts and graphics, as well as the copy post to go along with your social media message. And then there are a few flyers available here for download as well. And all of these flyers are customizable. And here's an example of the flyer that we have specifically for schools. So if you see in the bottom right-hand corner, this is where you can click and add your own logo if you would like to customize it, and also add your either phone number, address, or website if you would like to customize it yourself. And then you can save that and upload it to your website or your school site, or you can print it out and have this available to hand out to either students or parents. And these are some of the best practices that we have learned to reach families. So The use of existing social media channels already available by school districts. So some of these school district websites often have a wellness link that could link enrollers to the school site. Online counties or on their YouTube or Facebook, you can put these on there so people can have it available to explain how they can renew their Medi-Cal. We also recommend using virtual communications to distribute the ambassador materials. This includes any robocalls from the schools as well as posting on the school's website, or if there are any virtual presentations or Zoom meetings, and these can be shared on there as well. We also recommend developing text messages to families about redeterminations. And some schools already do this. So if you have the authority and capability to do this, we highly recommend developing these text messages to inform families about this information. We also recommend partnering with health plans to do school-based events where there's a high level of disenrollments. We know that some health plans offer incentives such as raffle prizes and things to families to draw people to these events. So we highly recommend partnering with health plans to do this. And all of these best practices we have tested already in the school districts in California and found them very helpful. These are some of the resources that we have available and links to them. So this will be available to you. So once you click on these links, it'll take you to the website that we've created, as well as the resources hub. There's a link here to get there to download all of the materials. And then we also have the Medi-Cal member facing web pages in English and Spanish. So either link will take you to the member facing pages where they can find information about like frequently asked questions or what they can do, or if they need information about renewals, they can find that information on these pages. So this is the end of the presentation. We will have a question and answer session now. So if you have a question, you can ask it in the Q&A option on the bottom right corner. And please remember to send it to all so that we're able to see the questions.
Thanks so much, Bonnie and Regina. And while we wait for some questions to come into the chat, I just wanted to take a moment and just give our sincerest appreciation. We know that our local education agencies are already doing so much for our children within California and for their families. And this is another layer of places where we're asking our local education to really engage with us on, and just really appreciate you taking time out of your busy schedules today to listen to what we have to share. We're hoping that these materials are helpful for all of you, but just want to elevate up how much we appreciate you showing up today and listening to the information we have. So I'll wait a couple of minutes. I'm not seeing any questions in the chat yet. So we'll wait and just see if anything comes up. We've included some of our contact information throughout the PowerPoint presentation. So if you walk away today and end up having questions as you bring this back to your local school district or your local school site or your local organization and want more information about anything that we shared today, or having challenges accessing of any of the information, or just are looking for some strategies to maybe customize them to your specific situation, please don't hesitate to reach out to any of the contact information that's on here, both the ambassador inbox that was included in the PowerPoint, as well as Regina's information that's included here as well. We work very closely together to make sure that we're able to answer the specific needs of our community partners. I'm not seeing any questions in the chat. So I know your time is valuable, and again, just appreciate you being with us here today. We will be posting the recording of this particular session onto our DHCS website. So if for whatever reason you had somebody that wasn't able to attend, but you want to make sure they have access to this information, you can always come back and revisit the PowerPoint at this time. With that, we hope everybody has a wonderful day and stays healthy. Take care, everyone.